Cancer has become a major talking point here in the state of Iowa. Scientists who study cancer say that while many things increase the risk of the disease, it's impossible to pin down all the reasons that someone gets it. Local 5's Max Swinson brings us more.
Besides nitrate, Central Iowa made headlines the summer of 2025 for another concerning statistic. Its cancer incidence rate. Incidence means new cases, so the cancer incidence rate reflects the risk of getting cancer. It's the second highest in the country and the fastest growing. That made people wonder, could Iowa's nitrate levels be contributing to the state's cancer rate? It's complicated because in the world of cancer, risk factors don't work alone.
The four cancers that seem to be setting us apart from other states have different geographical patterns, and if it were one thing causing our high rate, we would expect those patterns to be a lot more similar.
Those four cancers are prostate cancer, breast cancer, melanoma, and lung cancer. Mary Charlton has helped keep track of those cancers as director of the Iowa Cancer Registry. The registry collects data on every diagnosed cancer case in Iowa. Charlton compares getting cancer to the pie in Trivial Pursuit.
In the analogy of cancer, when you fill in all the pieces of the pie, you get cancer. So you're trying not to fill in all the pieces of the pie. And some of them get filled in for you.
Pieces like genetics, aging, sex, those are outside of Iowans' control. Scientists told us that environmental exposures, like nitrate, are more complicated. Most people move environments at some point in their lives, different cities, and in many cases, different water sources. However, a healthy person exposed to lots of things linked to cancer might still be less likely to get cancer than an unhealthy person exposed to fewer things.
If you're living a really healthy lifestyle, your immune system might be able to process those exposures very differently than somebody who is, heavy drinker, heavy smoker, doesn't get a lot of sleep. All those things, they're not going to be able to repair the damage caused by some exposure.
That's especially true for one group of Iowans.
People ask if our farming population in Iowa has higher rates of cancer. And the answer is no. Our farmers actually have lower rates of cancer compared to the overall Iowa population.
Farmers also smoke less, drink less, and are usually more active than non-farmers. Those healthy behaviors help reduce the risk of cancer. We know about farmers' habits because of this decades-long agricultural health study. It looked at 89,000 pesticide applicators and their spouses, 50,000 from Iowa and 30,000 from North Carolina. Almost all of those pesticide applicators were farmers. It's been tracking their health outcomes, including cancer, since the 90s. Very few studies have done that, which is part of why it's so difficult to study cancer.
And we just really don't have a good longitudinal record for people over the course of their lives about, their eating and dietary habits 20 years ago, or their drinking habits 10 years ago, or, what environmental things they were exposed to 15 years ago. We just don't have that.